Hey friends, Dr. Christy here, and I want to complain about something for just a quick minute. It's about insurance. What they do and do not choose to pay for and cover, okay? We've already established that insurance is not going to save your life. You yourself are responsible for that. But I've got two stories here that patients have shared with me over the years. One of which is she had a procedure done at the hospital and she was getting a meal. Now, don't get me started on the health content and nutrition content of what they serve patients in hospitals. Totally different story. But she didn't want any sugar in her meal. And they brought her Jello. And she said, I don't really want Jello. And she asked for a sugar-free variety. Now, once again, I'm not going to talk about the fact that the sugar-free varieties of things likely have other non-sugar additives that actually makes it worse for your health. Point being, though, they would not allow her to get a sugar-free Jello because she wasn't diagnosed as diabetic. So for someone to actually get what they want in their diet, to be healthier, at least in their mind be healthier, they can't do that unless they're diagnosably sick. Something wrong, number one. Number two is another patient of mine, once again, this is surrounding blood sugar, is she is not diabetic. In fact, she used to be labeled diabetic, and she's no longer diabetic. By the grace of everything that we've done, she's worked really, really hard to get her numbers in a good space. However, having been diagnosed as diabetic for a while still leaves her vulnerable. She still has to track her sugars. She still has to be conscious of what she eats and make sure she's exercising and doing all the right things for her body on a regular basis. Do you know that her insurance won't cover glucose monitoring strips for her to basically check her blood sugar from time to time to see how she's tracking? She has to wait once a year to basically see how she's doing if she wants that feedback from her body. This seems really ridiculous to me. So the people who are actually trying to be proactive about their health, trying to actually be what I call preventative in their approach. Prevention, you've heard me say this before, prevention in Western medicine is simply early detection. They check your stuff once a year and then they say, oh, congratulations, you're sick. We've caught it early though. What if we were actually just treating ourselves all year long and actually supporting our health all year long so that when we have that preventative well visit once a year, your doctor actually says, congratulations, you're really healthy. Just my 2 cents on the matter. I get a little fired up about these things when it really doesn't have to be that difficult. But at the same time, this is the system that we live in. So please make sure that you are taking your health into your own hands. If you are relying on your insurance to do everything for you and cover what it needs to be covered, you're likely going to be missing the boat because they don't really cover much as far as your health is concerned. They cover sickness, they don't cover health. Have a good rest of your day. Message me if you've got questions.